Hello there and welcome to another episode of your AKT Podcast. I hope you're enjoying the new set of podcasts that we've released. And if you're new to this podcast, do go back and check out all our other episodes. I'm sure you'll find them really helpful when it comes to revising for your AKT. Now in this scenario, we have a 22-year-old patient who is presented to you with a 9-month history of crampy abdominal pain with associated loose stool. There is no weight loss and no additional bowel symptoms. From your assessment, you are happy that the patient has no alarm signs or symptoms. What would be your first line investigations for this patient, and what would be your first line treatment options based on the most probable diagnosis from within this scenario? I'd like you to pause the podcast and just have a think about those two questions. So what would be your first line investigations and what would be your first line treatment options based on the most probable diagnosis? So before we consider the investigations here, let's just start with the diagnosis. So without diving into the scenario too deeply, I'm sure that we can all come to the assumption that this is possibly most likely to be an irritable bowel syndrome diagnosis. So in order to answer this question, based on the fact that this is likely to be an IBS scenario, we have taken some information from the British Society of Gastroenterology guidance on IBS. And they mentioned with regards to investigations that all patients presenting with symptoms of IBS for the first time in primary care should have a thorough assessment, of course, but within that they should have a blood bulk count, a CRP or ESR, celiac serology, and in patients who are under the age of 45 with diarrhea, a fecal calprotectin should also be undertaken to exclude inflammatory bowel disease, and local and national guidelines for colorectal and ovarian cancer screening should also be followed where indicated. And that's a really important part here. We can make diagnosis of irritable bowel syndrome, but we have to really ensure that we are excluding inflammatory bowel disease, ovarian cancer, and possible colorectal cancer. Now, the British Society of Gastroenterology guidelines on the management of irritable bowel syndrome is actually really helpful. Now, they mention that the following options can be considered as first line. Of course, the evidence rank varies for the different options, but from our perspective, I'm just going to cover what's considered under first line therapy. So exercise would be considered under first line therapy, dietary advice would be considered, and within dietary advice, there is your soluble fiber, which can be given as isabgula. Then you have loperamide, which can be used for symptomatic control. You've got antispasmodic medications such as your Buscopan or Beverine. You can also recommend peppermint oil, and probiotics, although the evidence is variable, can be offered if the patient is keen to try this as an option. In addition to this, there is some really good information regarding second line options within the British Society guidance, so do check that out because it will consider some of the treatment options that I've not mentioned today. Thank you so much for listening, and please do share this podcast with your peers. This podcast is hosted by wellmedic.co.uk. We help GP trainees pass the AKT.